Understanding heart blocks. The heart's rhythm is controlled by a precise electrical system. This system originates in the sinoatrial or SA node, the heart's natural pacemaker. The electrical impulse travels through the atria to the atrioventricular or AV node. From the AV node, the impulse moves down the bundle of His, bundle branches, and Purkinje fibers. This coordinated pathway ensures efficient contraction of the heart chambers. Heart block, or atrioventricular AV block, is a condition where the electrical signals that control heartbeats are delayed or completely blocked as they travel from the heart's upper chambers, atria, to the lower chambers, ventricles. This disruption can lead to irregular heart rhythms and, in severe cases, can be life-threatening. Cardiovascular diseases, CVDs, remain the leading cause of death worldwide. According to the American Heart Association's 2024 report, CVDs accounted for approximately 19.91 million global deaths in 2021. Heart block, as a component of CVDs, contributes to this significant health burden, as per heart.org. Types of heart blocks. Number 1, first-degree AV block. The electrical signals are slowed, but still reach the ventricles. It is often asymptomatic and discovered incidentally during an ECG. Its ECG characteristics are prolonged PR interval, 200 ms. Number 2, second-degree AV block. A. Mobitz type I. Progressive lengthening of the PR interval until a beat is dropped. Symptoms may include dizziness or lightheadedness. ECG shows gradual prolongation of PR interval followed by a non-conducted P wave. B. Mobitz type II. There is a sudden dropped beats without prior PR prolongation. It is more likely to cause symptoms like syncope. ECG will show consistent PR intervals with intermittent non-conducted P waves. Number 3, third-degree AV block, complete heart block. No electrical signals reach the ventricles. Atria and ventricles beat independently. Symptoms include severe fatigue, dizziness, syncope, and risk of sudden cardiac arrest. ECG will show no relationship between P waves and QRS complexes. Early signs and symptoms of heart blocks includes fatigue, dizziness or lightheadedness, shortness of breath, chest pain, palpitations, syncope, fainting, and bradycardia. Symptoms often correlate with the severity of the block. First-degree blocks may be asymptomatic, while higher-degree blocks present more pronounced symptoms. Heart block can be either congenital, present at birth, or acquired. Common causes include: Number 1, age-related degeneration, natural wear and tear of the heart's conduction system. Number 2, heart diseases, such as coronary artery disease, heart attacks, or cardiomyopathy. Number 3, medications, including beta blockers, calcium channel blockers, and digoxin. Number 4, surgical interventions, heart surgeries that may damage the conduction pathways. Number 5, infections, like Lyme disease or rheumatic fever. Number 6, inflammatory conditions, such as myocarditis or sarcoidosis. Diagnosis includes electrocardiogram, ECG, primary tool to detect and classify heart block. Holter monitor, continuous ECG monitoring over 24 to 48 hours to detect intermittent blocks. Event recorder, patient-activated device for recording symptoms. Electrophysiological study, invasive test to assess the heart's electrical system. Heart block prevention. Control underlying conditions. Manage hypertension, diabetes, and thyroid disorders. Treat infections like Lyme disease and rheumatic fever promptly. Review medications. Some drugs, for example beta blockers, calcium channel blockers, digoxin, can slow heart conduction. Consult your doctor before starting or stopping any medication. Healthy lifestyle. Eat a heart-healthy diet, low salt, low fat. Exercise regularly, 150 minutes week. Avoid smoking and limit alcohol. Manage stress through relaxation techniques. Monitor electrolytes. Keep potassium, calcium, and magnesium levels within normal range. Routine screening. Get regular ECGs, especially if over 60 or at risk. Report symptoms like dizziness, fatigue, or fainting early. Now let's dive into the treatment of heart blocks. First-degree block often requires no treatment. Monitor for progression. Second-degree block, Mobitz I, may not need treatment unless symptomatic. Second-degree block, Mobitz II, and third-degree block typically require pacemaker implantation. Medication adjustment. Review and modify drugs that may contribute to the block. Emergency interventions. In acute settings, temporary pacing or medications like atropine may be used. Latest research and innovations includes dissolvable pacemaker. Researchers at the University of Chicago have developed a minimally invasive pacemaker that dissolves over time, potentially reducing complications associated with traditional devices. Prevent risk calculator. A new tool developed by the American Heart Association to assess 10 and 30-year cardiovascular disease risk, aiding in early intervention strategies. RNA-based therapies. Advancements in RNA therapies are showing promise in treating various heart conditions, including those leading to heart block. In summary, heart blocks represent impaired conduction from the atria to the ventricles. They range in severity from the benign first-degree block to the critical third-degree block. Accurate identification via ECG is essential for determining prognosis and guiding appropriate management strategies. Understanding the underlying mechanisms and clinical implications of each type is vital for patient care.